Noswaith, noswaith a croeso bawb. Good evening and welcome everyone to this evening's lecture. It's a great pleasure to be able to introduce my colleague, Dr. Rhys Bevan-Jones, to you this evening. Rhys is a Senior Clinical Research Fellow in the Division of Psychological Medicine and Clinical Neurosciences and the Wolfson Centre for Young People's Mental Health within Cardiff University. Rhys is also a consultant psychiatrist with Cwmtaf Morgannwg University Health Board. Rhys is interested in mental health difficulties in the transition from child to adult life and is dual trained in both child, adolescent and adult psychiatry. In addition to his medical training, Rhys has a degree in illustration and animation and is interested in the intersection of mental health with visual and digital media. His work in this field has been recognised with 2 fellowships from the National Institute of Health Research, and last year he received a Health and Care Research Wales Advancing Research Award in order to further develop and explore digital and youth mental health. Rhys, diolch yn fawr iawn. Thank you very much for kindly agreeing to give this evening's lecture. Over to you.
Diolch yn fawr, noswaith dda. I'll just share my slides. Hopefully you can see that okay.
That looks great, Rhys.
Yeah, great. So, yeah, thanks for the introduction and diolch. Thank you for the invitation and for everyone for tuning in. I'd like to talk tonight about our work at Cardiff University in co-developing digital mental health support with young people. And by support, I mean resources, interventions. And I'll just give a little bit more background. So I have quite a varied week. As was just mentioned, I work a couple of days a week on a Health and Care Research Wales Advancing Researcher Award, mainly in digital and youth mental health and looking at the transition from child to adult life in the context of mental health difficulties. And then on the top left there, I work with the Wolfson Centre for Young People's Mental Health SWELL trial. So this is a trial of group therapy delivered online for young people to help in the prevention of depression, but also involved in helping with the parents of those young people taking part. I'm also a psychiatry advisor with Canopy in the top right there, which is a mental health support service for NHS and social care staff in Wales, as well as on a grant for early onset depression. And I've been working with child and adolescent services in Merthyr Tydfil. So I'm not going to deal with very sensitive topics, but clearly it's in the field of mental health. And clearly if anyone feels that they need support during or after this, then feel free to have a look at these sites. They're also might be of interest in any case. So Young Minds is one I recommend in particular in clinic for young people. Make Cymru is a group in Wales to support young people in general. Mind and Samaritans obviously are well-known charities. National Centre for Mental Health is a group in Cardiff University with a lot of good and bilingual resources. Whilst the Royal College of Psychiatrists is more of an UK body, again with lots of mental health resources. I find that there's more and more good and accurate information on the NHS mental health website and meddwl.cymru, a Welsh language group. So Meddwl is more of a general mental health website, and mub.cymru is for student mental health and other challenges. So a bit of background about digital support for young people. We know that depression and anxiety are common across the age ranges, but they're also common in young people, but we also know that many aren't getting any help, especially any formal help. And digital technologies have been proposed as a way to reach more people at low cost compared to face-to-face therapies, and are recommended by NICE, which is the body that we follow and that develop guidelines for healthcare professionals. So NICE is the National Institute for Health and Care Excellence. So we've looked at this area quite a bit and found that programs are needed that are accessible, evidence-based, co-developed with the people who are going to use them, and also evaluated using standardized research frameworks. I have a screenshot there of two papers that we published in this field. If you're interested in co-development, especially, or co-design in this area, you could have a look at the one on the left there, the co-design of digital mental health technologies. And then on the right is a broader review of resources, digital resources and intervention for depression, anxiety in young people. So the main program we've developed in this area is Mood Hub, or Hub Hwyliau in Welsh. So this aims to fill the gap that I've just identified. A hub in Welsh can mean a hub or a lift or a boost. And Hub Hwyliau similarly it reflects how the overall program is a bilingual program, and it can be delivered as a website or an app to promote self-help, help-seeking social support for young people. And we developed it with young people aged 13 to 19, so particularly helpful for that age range, but also to help families, carers, friends, and practitioners. It's based on psychoeducation, which is the delivery of accurate healthcare information, and cognitive behavioral therapy, which is about looking at the thoughts, feelings, and behaviors, the interactions between these, and also ways to help. So CBT, you might have heard of in short. And I've discussed with a lot of people about how this could be adapted for different groups, for example, students, those with neurodevelopmental conditions, and also other countries. So we have colleagues, for example, in the Republic of Georgia and Ukraine. We've discussed this with. And on the right there is a picture of the initial version of Mood Hub on a tablet. So as well as the need for this program, there were other influences that led to the development of the program many years ago. So it brings together many elements. So at the time it was initially developed, there was a project going on here at Cardiff University called the EPAD study, Early Prediction of Adolescent Depression. And that followed families where there was a parent with depression and their child. And we found that when we were talking to the families, they were looking for resources and interventions that could help the young people and the parent and carer. Also, there was a growth in digital health, so the development of online programs to help individuals. So, for example, at the time in Cardiff University, there was a program called Beating Bipolar being developed and evaluated for adults with bipolar disorder. And I understand that's still going. You might want to look at the National Centre for Mental Health site for that. And also, there was some work being done in youth mental health. So, for example, the program Sparks was developed in New Zealand by Professor Sally Merry and her team. And they published in the British Medical Journal about their findings. And I got in touch with her, and she kindly agreed to be my mentor, and she has been ever since. And I've been out there to visit the team and learn from them, and also other researchers in Australia and across the world. And as was mentioned in the introduction, I also have a background in visual communication. And I've always been interested in how it's possible to communicate subjective experiences through visual and other media. You know, we lack the visual medical references that other medical professions have, or other medical specialties have. And so it's a challenge to depict such experiences. And this can, and I was interested in how to use, we could use these to help communicate and also engage young people, for example, with the use of icons and metaphors. And just the overall development and evaluation of Moodhub has aligned with my training and my development as a clinical researcher. So, for example, looking on the left there, a lot of things came together for me in terms of the clinical psychiatry, the research and teaching, visual communication, and also my first language is Welsh, and so I was interested in developing bilingual and inclusive resources and interventions. So I applied for a doctoral research fellowship by the National Institute for Health and Care Research funder, and I was lucky enough to get that. And that was based on my application to co-develop and do an early evaluation of this MUTA program. We didn't know the name at that time, but that was the plan. And then I was awarded another fellowship after that with the same funders. So I should say not just NIHI, it was also Health and Care Research Wales, to develop this further and do a big trial of the program. And then last year, I started a Health and Care Research Wales Advancing Researcher Award to look further about the next steps for MoodHub and more broadly in digital mental health, and also look at transition mental health. So, sorry, this is a busy slide, but this is really the initial development or the development of the first version of the program in just one slide. And so it's my doctoral fellowship or my PhD in a snapshot. So I'll break it down, but you might find that there's some citations next to the different components. So these are papers where we've described in detail the different processes. So in green there we did a systematic review, looking at the area of interventions for depression in young people and later looking more at anxiety as well. Then in orange was the co-production or collaborative phase where we look, in the discovery phase, we did a number of interviews with young people, parents, carers, and professionals. And then the initial ideas led to the development of the program through focus groups and workshops in the co-design phase. We also worked in the blue box in the middle there with a digital media company made by Moon that had worked with the BBC and Channel 4 and Lego. So we were really interested in developing engaging technologies for young people. And also we subcontracted an animator who developed a lot of the sort of character designs and the storyboards with us. And then in purple there was an early evaluation of the program, which I'll go into in a bit. And yeah, very pleased to be awarded an ACAM award a couple of years ago. So that's the an UK body, the Association for Child and Adolescent Mental Health. And this is a Digital Innovation Award for our review of the co-design field in digital technologies and the guidance that we published in this review. And this model of co-development was published as a case study in that. So if I focus in on the orange blocks, so this was the co-production phase. I'll give you a bit more detail on how we did this. So you can see on the right, there's a series of interactions with young people, parents, carers, and professionals. So on the top there, we did the interviews, as I mentioned, and then we went down, did a focus group with young people and professionals, young people, and so on. And then as we were working with a digital media company, the first few focus groups were just to generate the initial ideas and sketch things out. And then as we went along, we were able to show the initial designs and the initial prototypes to the young people and the other groups in the focus group. So, so it's very much an iterative process. And then, so by the end of the process, so focus group 6, we had a prototype that could be loaded onto laptops and tablets in the focus groups so they could be used. I was really keen to develop engaging information sheets as well to help with the recruitment and information for young people and others taking part. So you can see in top left there, the information sheets with some of my illustrations. And then the bottom left was one of the rooms where the focus groups took place. And so this is in the Hayden Ellis building in Cardiff University. And you can see there's a screen there, big screen, where we could show the initial ideas, the initial version of the program, and there was a drawing and writing materials on the board, and time and space for people to discuss. And this is a little more detail on that. So as you can see at the top there, we went from post-it notes and sketches through to wireframes, which is like the overall structure and functionality of the program. And then on the bottom, we went into the black and white and the color designs for the welcome screen. And all of this is documented in a paper that's cited at the bottom. And as far as I know, I think all the papers that I'm citing are open access, which means you can find them online and you don't have to pay a fee. So just going back to the model and focusing in on the early evaluation in purple here. So we asked young people to use the program over a couple of months. And we used questionnaires. We asked them to complete questionnaires at the start and after using it, after a couple of months. And we asked some people to be interviewed. We've held a focus group with professionals as well and monitored web usage. And at that time, so we were keen to have concentrate on this, not just around Cardiff, but also further out in South and West Wales. This was pre-COVID, and all the questionnaires were paper-based. We did a lot of face-to-face, in-person discussions and interviews, and it was quite a broad recruitment approach from mental health teams, schools, and also the previous studies like the EPAD study I mentioned and the National Centre for Mental Health. So over 40 young people and over 30 parents and carers took part, and over 80% of them remained in the study. So we had a lot of feedback from the participants, and as you can see from these quotes, a lot of favourable and positive feedback, but also lots of constructive feedback on how we could improve this initial version of the programme. And again, we wrote this up in a paper, which is cited at the bottom there. We also had some information and data from the questionnaires, which suggested that the program is particularly helpful with for young people to understand their symptoms, and also in terms of self-esteem and potentially depressive symptoms. So that was the end of my doctoral fellowship, so my PhD work, and then I applied for the second fellowship I mentioned. And for the initial period of that fellowship, we worked with young people and what's called youth advisory groups to develop a second version of the program based on the feedback from the early evaluation. We involved several different youth advisory groups. So probably in the first part of the project, so the work I've just been describing, we involved the Alpha group quite a lot. So this is a youth advisor group based in Cardiff University, aligned with the Decipher group, which is involved with the development and evaluation of public health interventions. So they were really helpful. And then from then on, we involved the Wolfson Centre for Young People Mental Health Youth Advisory Group, which was set up around the time I started the second fellowship. So we did a lot of in-person work, a lot of online work, and again, it was quite an iterative process where we consulted them and worked with them at the start, and then as we were developing the program further. We had some interaction as well with the National Centre for Mental Health group and also the Triumph group, which was an UK-wide body based mainly with the University of Glasgow, but with young people across the UK. And then we arrived at the second version of Mood Hub or Hub Hwyliau. And so this is the welcome screen. You can see on the left is the website version, and on the right is the app or mobile version. So you get a feel for the sort of character design, the icons. We wanted a fairly universal approach, so the characters are silhouetted. We did a lot of work on the color design. You can see here there are 6 sections for young people. And for this second version, we expanded the self-help sections in particular, so created 2 versions, but 2 sections, but also peppered more and more self-help activities and information in each of the other sections. We also developed the app much more, so it's a fully functioning app, native app. We also worked on the anxiety information and self-help strategies, brought that to the fore, and worked on the language as well, less on depression as a diagnosis and more on low mood and other symptoms. And as you can see, there's a section there for families and carers and an introductory section there. It's on the App Store and Google Play, so we did a lot of work there. And you could find it on those platforms, but you would need a login, which we gave to those taking part in the research. The other thing is you might wonder what these stars are and what the numbers are. So these relate to the number of subsections that are particularly relevant to the young person. So bringing a tailored approach. And they reflect how the answers that the young people gave when they answered the initial questions as they logged into the program. And those questions also acted as a mood diary. So the sections within the program followed similar structure so that the young people could get used to the navigation. So you can see on the left here, so this is the introductory section for one of the self-help sections. And there's a progress bar at the top there. And the stars are the sections that are most relevant to the young person. There's an animation at the start of each section. There's texts, quizzes, personal stories, links to other resources, questions about yourself, and also downloadable PDF worksheets. There are 3 particularly interactive sections which work especially well on the app. So that's the mood diary, the goal setting section, and useful links where you can store links to helpful resources. And these were developed far more for the second version. And we also spliced the animations we developed so as to create GIFs, which could be peppered throughout the program and on different web pages to make them more engaging and also to communicate key messages. And as you can see here, we used metaphors like the weather metaphors, balloons to represent the family tree, thoughts as clouds, and an umbrella here to represent sort of the shielding and support in the parents' care section. And there was a lot of these created with the animator, and so there was a lot of back and forth with me helping with the storyboards and the drawings. So this is an introductory animation that young people can watch when they log into the program to get an idea of how to use it. Also gives an idea of the character design and the color schemes, the icons, the metaphors, and the tone of the program. So I'll just show you the first couple of minutes of this animation to give you an idea of it.
It's normal for young people to feel down and not enjoy things sometimes. If these feelings are long-lasting or keep coming back and begin to affect day-to-day life, This could be a sign they need some help, either by finding ways to help themselves or by getting help from others. Low mood and anxiety often happen together and can affect people of any age. It is common for young people to experience these difficulties.
This program can be used as a website or an app. It is for young people and for families, carers, friends, and professionals who would like to know more about low mood, anxiety, depression, and other health difficulties. It also has advice on self-help, ways of staying well, and where to get help.
You might use it because you're having difficulties. For example, if you're feeling down, worried, or stressed. It's possible that you only have some difficulties, or that you have many which are affecting your life a lot. You may have been given a diagnosis of depression or anxiety. Or maybe you're worried you might have difficulties in the future. For example, if someone in your family has had problems with low mood, anxiety, or depression, or if you're under a lot of stress. Or it might be used by a family member, carer, friend, or professional who is worried about a young person.
This program has been developed from talking to lots of young people, including many who have had difficulties, as well as families, professionals, and designers. It's also based on the best research available and is supported by many organizations.
It's been built so that it's safe, secure, private, and confidential. There are various options to help personalize it. You might like to use it on your own or with someone you trust. You can choose the language, and the hide button can be used to leave quickly at any time. Answering the questions at the start helps to find the sections that are most relevant for you and helps you to notice how you're feeling, so you know when you might need to do something differently or when to ask someone else for help. It's also possible to skip the questions and just browse. All information you put into the program will only be seen by you, although you might like to show it to someone you trust.
Yeah, so that gives an idea of the program to you. And as I said, we involved youth advisory groups throughout the process of development and the second phase of development. And yeah, these are comments and feedback from the Wolfson Centre Youth Advisory Group towards the end of the process. My favourite quote is this one saying, probably the first digital platform for mental health I've seen, where I've thought I'm going to look that up later. This might actually help me. So really pleased with that, and we received lots of the positive feedback, and but also made a note of anything else that young people and others thought would be helpful to include or to change. So then we went on to what's called a feasibility trial. So the aim of a feasibility trial is to look at the feasibility and acceptability of an intervention and the method. So in this case, Mood Hub and the trial methods. So rather than looking in particularly at whether something works in practice in reducing symptoms, for example, or preventing a certain diagnosis, it's more about, for example, the intervention, whether it's technically robust, whether young people feel they can use it properly, whether it's user-friendly, they can navigate it properly, whether they are happy with the design and the content. And the same with the trial methods, whether you're able to recruit people for this kind of study and keep them within the study and complete all the assessments that are required. So a secondary measure, secondary aim of this trial was to measure the potential impact of the intervention. So especially things like depressive and anxiety symptoms. And for this, we included young people aged 13 to 19 years again, so similar to the early development and evaluation phases, and included people with low mood or other depressive symptoms. We did this by asking people to go to the study website and fill a questionnaire, which included questions on themselves, but also a standardized depression questionnaire for young people called the Mood and Feelings Questionnaire. And then we recruited also in Wales and in Scotland. Wales because we developed it here, and Scotland because one of my mentors, Professor Sharon Simpson, is based at the University of Glasgow and had a lot of links there. But in the future, we would like to open it more broadly. We also invited parents and carers of young people taking part. And on the left there is one of the posters we designed for the program and for the trial, and the protocol or the plan for the trial was published as well in British Medical Journal Open Journal, and you can read that. That's open access. So we did a lot of work in terms of promotion and recruitment, and the trial was disrupted by the COVID pandemic, and also that changed our approach so that it was mostly an online study. So young people were asked to go to the study website, fill online questionnaires, do interviews through video calls, and the focus group was done on a video call as well, and web usage was also monitored. So there are pros and cons, of course, of doing a remote trial compared to an in-person trial. But this seemed to fit as well, not only with the context of the pandemic, but also the nature of the intervention. And we worked with the youth advisory group to develop the resources. We had different approaches, as you can see, in terms of posters, as I showed before, postcards, social media. We asked an influencer on the top left there. I even went on the Prynhawn program, which is similar to the One Show, and also did some radio interviews. And it was very slow, which is quite common in trials at the start, but we gradually got there. As you can see here, we recruited, in Wales and Scotland, but we were quite pleased in the distribution of the participants. So it wasn't just those around Cardiff and Wales, so quite a few from West Wales and North Wales. And similarly in Scotland, not just those around the Glasgow area where our colleagues were based, but some from the Highlands and other areas of Scotland as well. And again, we took quite a broad approach in recruiting from schools and schools research networks. So for example, Shern, which is based in Wales, the Schools Health Research Network, and Shine, which is the equivalent in Scotland. And we also recruited from mental health services, student support services in universities and colleges, charities, especially mental health charities and youth charities, and as I've just shown you, social media. So this is these are the numbers we eventually recruited, and well, if we go from the start at the top there, we saw that over 300 young people submitted the online form on the study website and showed an interest then in taking part. And then if we go down a block, we found that over 200 were eligible. So as I said, within the age range with a certain number of symptoms and in the places I described. And then eventually 122 consented and took part in the study. The others either changed their mind or we are unable to contact. So this is a common way to represent the flow of participants in a trial. So then after they agreed to take part, the participants were asked to do a complete what's called baseline or initial questionnaires, and they were randomized by a computer into the intervention arm, which is, so they would receive a login into MoodHub or go into the comparison or the control arm, and they received digital information sheets. I should say that everyone would go on to continue the usual support if they were getting any support. And also everyone in the study also received gift vouchers and certificates for taking part. So we've randomized it in a 2-to-1 ratio. So you might notice that there's more in the Mood Hub arm of the study. And that's because we were interested in the feasibility and how acceptable the program was for young people. And so focused more on there. And you can see then the numbers that remained in the study after 2+ months. And we interviewed 25 young people and 12 parents and carers, and monitored the web usage and did a focus group with professionals. I'm finishing writing up the paper on this trial, so hopefully it will be available open access later this year. So if you'd like more detail at that, do look out for that paper. But one thing that's worth mentioning is the progression criteria. So when you're planning a feasibility trial and thinking ahead whether to go on then to what's called an effectiveness trial or efficacy trial, so looking at whether the intervention is actually helping the participants or your target participants in for example, in the NHS, in reducing symptoms or preventing certain difficulties, then it's important to look at the findings from your feasibility study and then compare those to the progression criteria that you set out before starting the trial. So you can see here on the column on the left, the criteria related to the trial methods, but also the Mood Hub intervention. And then in the second column is the number of young people related to each of these criteria. And then on the right is the indicator. So we followed it like a traffic light signal. So green would be a very strong indicator to proceed to a full trial. Amber, a medium indication where you need a discussion with the steering committee and other collaborators. And red would be indication of doubt. So you can see here, we reached our recruitment target and our retention target, so that's both green. There's some concern about the level of usage, so about 75 people logged in, and also there was quite a range in terms of the pattern of usage. But we had very good feedback on the acceptability of the design and the content. So again, that was a green. So overall, quite positive, but thinking about the next steps, we need to think about refinements, whether the intervention needs more guidance from practitioners, for example, in practice. So maybe someone to help them at the start and check in with them as they're using the program. When we're thinking about further evaluation and implementing in, so for example, schools and services. And as I mentioned before, we've been discussing with various groups about adapting this for students or other countries, and also maybe developing a broader digital ecosystem, which would include programs, for example, for those with neurodevelopmental conditions or other mental health or other mental health difficulties aside from depression, anxiety. And so we found that, in summary, that Mood Hub was co-developed rigorously with young people, parents, carers, and professionals. The early evaluation showed that it was acceptable to young people, and the feasibility trial completed last year showed that most progression criteria met, and we need to think carefully about the next steps. I'll just finish off to show how there are other important youth mental health projects going on, including in the field of digital mental health at Cardiff University, including the SWELL study, which I mentioned earlier. So this is a skills for adolescent wellbeing study. So this is a trial of a group cognitive behavioral therapy for young people to help prevent depression, where we also help support the parents of the young people taking part. This is still ongoing, recruiting until late summer. And so if you're interested, you can search SWELL and Cardiff University online, and you'll find the webpage, and you'd fill in a form on that. So if you're a parent who's experienced low mood, depression, and a child in this age range, this might be of interest. And a lot of co-development went into the these resources, the promotion material, also the workbook, and the design of the intervention. There's also a bilingual animation about attention deficit hyperactivity disorder, ADHD, online, which you can find on the National Centre for Mental Health website. Yeah, this is in both in English and Welsh. And as you can see, we worked with, again, careful about character design, icons, metaphors. We did several workshops and focus groups with children, sort of late primary, early secondary school age, and their parents and carers to develop this, and worked with practitioners as well. And finally, Spring YP. So this is an adaptation of a post-traumatic stress disorder program, again, using cognitive behavioral therapy, sort of trauma-focused CBT, to help adults with PTSD. But that program, Spring, has been adapted to for young people, and it's called Spring YP, so YP, young people. That's just been completed, and we're just evaluating it now in a service in South Wales. So yeah, please, if you're interested, get in touch. That's my email address, my social media handle, and there are references there related to Mood Hub, the other projects I mentioned, and also more broadly, co-production guidance. There's more and more guidance and more literature in this field, developed by different bodies. And those are the websites I showed right at the start, in case you're interested. And I'd like to thank young people, especially in the youth advisory groups, who have helped me along the way, and the families, carers and professionals, along with my mentors, the trial team, digital media team, and those who have helped with the communications and the involvement with young people. Diolch yn fawr. Thanks for tuning in. I think there's a period now for any questions, but yeah, really appreciate that you've taken the time to join us.
Thanks indeed, Rhys. That was fascinating. Thanks for stepping us through the stages of the development of this exciting resource. I'm sure there will be questions from our audience this evening, so participants, feel free to type your questions into the Q&A, which you should find at the bottom of your Zoom screen. Rhys, perhaps I could maybe just start things off. When do you think you will be able to start evaluating the efficacy of the resource? How far away do you think you are from that?
Yeah, it's a good question. I think it all depends clearly on funding, and there are grants available, for example, from the National Institute for Health and Care Research funder. Wellcome are also interested in this field. And we hope to be able to apply for funding this year. As I said, we're just writing up the trial findings, and we'll have a discussion. And then, yeah, hopefully then start the trial. That would probably be end of this year at the very earliest, probably going into next year.
Okay, great. So Rhys, it's been very much in the news this week, the issue around diagnosis of or possibly overdiagnosis, over-medicalization of mental health in adolescents. Would you like to make some comments as to what has been said in the news this week?
Yeah.
West Streeting, I guess. Yeah.
Yeah, I haven't seen the full interview and the full transcript. From what I understood, there was a discussion about diagnosis, but also I think there was a recognition that a lot of people weren't getting the right support. And so, people were maybe who were experiencing some difficulties because they weren't getting the right support. Their problems would escalate and affect their lives even more. And so there was a recognition that more investment was needed for that. I think there's greater awareness now, which is a good thing, and I find that from talking to young people in schools, the literacy in terms of mental health um, is a good thing, so that young people and others are more likely to go for help than they used to, maybe.
Yes.
But I mean, my only comment would be that if you are concerned, I think best go to the GP and have a proper assessment from the GP or mental health services or other groups, and then that would resolve the issue of diagnosis.
Thank you. So picking up some questions that have come in from our participants then, I think you did touch on it at the end, but if you could clarify, is there an app on CBT with focus on engagement for people with ADHD that struggle with focus?
Yeah, so our department actually does a lot of work in ADHD. The only resource we've developed ourselves is the animation that I mentioned for children. We are looking at developing a broader resource for children and young people. I'm not aware of an evidence-based digital technology for ADHD, but again, I'd need to look at that. I know there are, I find myself there's a few of them that come up on social media, but it's important to look at the evidence base. And again, I don't think there are any recommended by NICE, which is the body that we follow, but there are technologies that are recommended in terms of the assessment and monitoring of ADHD symptoms.
Thank you. Um, can an adult use this app for themselves? Are there going to be equivalent resources for adults or?
Yeah, well, so far we've had lots of interest from those older than the age group that I mentioned. So, early 20s, for example, and I've had feedback,
population,
yeah, feedback that they might be interested in using this, and that actually a lot of it would be acceptable for them. And that's something we're looking at. But there are there are other programs for adults, like Mood Gym. Silver Cloud is being used as an online therapy in primary care. I know Stress Busters have been developed as well, but that's more for young people. So yeah, there's a range of there's probably more adult focused technologies.
Thank you again, Rhys. Have you understood any particularly risked groups towards this question? Do you believe the modern generation is soft?
I think so. Risk groups, yeah. No, I mean I wouldn't use those terms. I think there's, as I mentioned, more awareness of sort of well-being and mental health difficulties in young people these days, and that's through I think through the education system and from peer discussions and online material. I think that's a healthy thing.
Yes.
And so I think there's a greater awareness of individuals' thoughts and their feelings. And I think in general that's a good thing. So they can then monitor then when they need to go for support. Clearly, if there's a over involvement or a fixation on difficulties, that can cause problems in their own right. But that's something that um, we always talk about, in when we talk to young people, for example, through assessments and therapies.
Yes. Interesting question here, Rhys. Would adapting it for young people with learning disabilities be on the card soon? I work in this field and can imagine many people I work with really engaging with the app, especially those with ASD and speech and language difficulties.
Yeah, so thanks, Sinead. Sinead was involved early on in the study and helped with the recruitment. So thank you, diolch, Sinead. And Yes, we have discussed this with various people. It's come up when I presented this to different groups. So, for example, adapting it for as I said, those with neurodevelopmental conditions or with learning or intellectual difficulties. I think on the whole, we have had people with traits or a diagnosis take part in the development and evaluation of the program, and on the whole, we found that it's acceptable. But again, there is, I think, justification for looking at maybe modifying it or creating additional sections for these groups, and definitely that's something we've been looking at.
Great, thank you again, Rhys. Um, uh, is the hope that eventually this might be adopted by the NHS? Someone's asking.
Yeah, hopefully, and I think being very careful in following guidance for co-production and evaluation, doing this very rigorously and over a long period, and I think this is something that the NHS calls for. That they want this level of involvement and evaluation, and hopefully this can be recommended by guidelines, and then used in mental health services, but also it's been suggested it could be used in schools, for examples, and through charities and other bodies. Yes.
Rhys, would you perhaps comment on the impact of the pandemic on mental health in young people, and possibly what might be some of the risk factors, the strongest risk factors for adolescent depression?
Yeah. So we found in the mental health services that the COVID pandemic had a big effect and is still having an effect on children and young people. And in various ways, we found that initially during the pandemic, a lot of people were, and this includes adults, they weren't going for help because of the concern about the infection, and because they were a burden on the services, and because of maybe they didn't have as much access as before. So that meant that people were presenting later when things were more severe. But also the nature of the anxiety and social withdrawal that happened with the pandemic that led to difficulties in its own right. And I've seen people in clinic who dropped out of school, for example, and during that time, and just have found it very difficult to go back.
Yeah.
And it could be in part because of the prolonged nature of that school absence. Um, there's a lot of other things we don't understand about, long COVID, for example. And you mentioned risk factors for depression. Yeah, there's the multifactorial. We're thinking, clearly environmental stresses like school stresses, bullying, peer relationships, as well as familial stresses and more genetic stresses as well.
And is it fair to say that social media is a double-edged sword in that, we've seen this evening where there's potential benefit to be had, but at the same time, we hear stories of how it's impacting in young people's lives in a negative way, placing them under peer pressure and what have you.
Yeah, no, I think you're right. Double-edged is right. I think it's important to have a balanced approach to the internet and also social media. A lot of it is there's a lot of negativity about it, but we do know that it's a form of communication for young people. The nature of communication has evolved over the years, and maybe often this is way we're making friends and sharing things with friends and peers. But clearly, also on the flip side, it's created a new source of bullying, like cyberbullying online. People use filters and change their appearance, and they can't reach the appearance they're looking for. And there's problems in terms of body dysmorphia, for example, and eating problems and anxieties around that. But it's a whole new area. Yeah.
Rhys, I think we seem to have exhausted our questions for this evening, so it just remains for me to thank you once again for a really outstanding presentation this evening. We will watch the development of this story with keen interest, I'm sure, and we wish you all the very best for the next steps in its development. More broadly, I'd just like to thank our audience this evening and to highlight that the last lecture in our series will be on for this academic year at least, will be Thursday, the 10th of April, when we have again two colleagues from within the university, Thanasi Hasoulas, and that's Dr. Thanasi Hasoulas, and Professor Marcus Coffey, who are going to be discussing the applications, the implications of AI in medicine. So we hope we'll see many of you back again next month. So, diolch yn fawr iawn. Thank you very much, everyone. Nos da, and especially thanks to you, Rhys. Diolch.
Diolch. Nos da.
Nos da.